Hi, everyone. Welcome back to those who joined us for our morning segment today, and welcome to those of you who are joining us new for the first of the Immigration Partnership's Brown Bag Lunch Learning Series. I'm Tara Bedard, the Executive Director of the Immigration Partnership and the facilitator for today. I would like to extend a warm welcome to our presenter, Farah Patadia. Patadia? Sorry. Somebody's coming in my office. And to all of our attendees, and say a big thank you to our Settle and Belong Steering Group staff and partners who planned today's event. I'm going to start us with a land acknowledgement. I think we have some new people joining us. The Immigration Partnership is focused on helping immigrants reach their full potential. Except for our Indigenous neighbors, at one point, we or our ancestors all came to this place seeking to be welcomed and wanting to reach our full potential. A land acknowledgement is a way of honoring the land on which our successes have been built and the Indigenous people who have been living on and caring for this land for thousands of years. It is a long-standing protocol among Indigenous peoples that honors their spiritual connection to the land. So I would like to acknowledge that the land on which we are gathered today, those of us here in Waterloo Region, is the traditional territory of the Haudenosaunee, Anishinaabe, and Chinootan peoples. We are occupying land promised to the peoples of the Six Nations and the Haldimand Tract, which takes in 6 miles on either side of the Grand River. We acknowledge the enduring presence of the Indigenous peoples with whom we share this land today, their achievements, and their contributions to our community. We offer this acknowledgement as an act of reconciliation between Indigenous and non-Indigenous peoples of Canada. So I hope everyone who is with us and was at our morning session enjoyed the first part of our day together and that you all found it valuable. And I'd like to introduce all of you to Farah Kotadia, who is joining me on screen. Farah, it's nice to see you for a discussion of navigating mental health well-being amidst global conflict, tips and tools for client care and self-care for those in the helping professions. World events and consistently being surrounded by news of global conflict and other societal challenges have an impact on our mental health. We will now explore how to take care of our clients and ourselves during difficult times. Farah will walk us through some tips on well-being, how to be trauma-informed, navigating vicarious trauma, and dealing with trauma bonding in the workplace. She is a champion of mental health awareness and a human resources professional who has worked in the immigrant integration sector for the last 18 years in leadership and frontline roles. She is currently the co-manager of the Vancouver Local Immigration Partnership, one of our sisters in Canada. With an MBA in HR and over 25 years of experience in the field, Farah recently achieved her lifelong goal of completing her master's degree in counseling psychology. Focusing on intersectionality between newcomer integration, clinical counseling, and human resources, she works with newcomers and other clients who have lived experience with anxiety, depression, grief, loss, and trauma, as well as those who are searching for meaning in their work and those who are exploring career transitions. Her passion is helping people develop appropriate strategies and coping mechanisms to realize their power and potential, both personally and professionally. This session will be 90 minutes long and there will be time for Q&A. Farah, the floor is yours.
Thank you so much for that introduction, and thank you for, saying my name correctly right off the bat. I didn't have to correct you. That's awesome. Thank you. I appreciate that. Good afternoon, everyone. Thank you for coming back after your break. As a presenter, you're always a bit afraid that nobody's going to show up, so I really appreciate you coming back, and I hope you all had an informative morning. So as Char mentioned, my name is Farah and I will be your facilitator for the webinar, Navigating Mental Health Wellbeing Amidst Global Conflict. I would like to acknowledge with gratitude the privilege of living and working on the unceded lands of the Squamish,
Musqueam, and Tsleil-Waututh nations, now called Vancouver. The presentation today will be about 30 to 40 minutes, followed by discussion and Q&A. And I would really like this to be an interactive webinar. It's often difficult when we can't see each other or speak to each other, but I urge you all to engage by using the chat box for general discussion and then the Q&A box for specific questions. And I will prompt you to write your thoughts in chat. Okay, so let's get started. Do we have the PowerPoint up?
Yes, Farah, just give me 1 second. I'll get the PowerPoint going.
Sure, thank you. Okay, so while Abia is getting, there we go, the PowerPoint up. I wanted to tell you a little bit about what we're going to cover today. So we'll talk a bit about trauma, what is trauma, and how to do our work with that trauma informed lens. Then we'll talk a little bit about vicarious trauma and trauma bonding. And then we'll open it up to Q&A and discussion. So thanks very much, Abiha. Next slide, please. The next slide, what is trauma? Great, thank you. So since the COVID pandemic, people have become more aware, I think, of mental health wellness and the importance of self-care. You know, there is just so much happening in the world right now, from war and conflict to natural disasters. It can sometimes be difficult to find the joy in everyday life, right? Especially when we are so consumed by news and social media, and much of which is very negative. So it can have a traumatic effect on us. Let's begin by defining what trauma is. We can really group trauma into two types, big T and little t. Can you give me some examples of what would be considered big T trauma? Feel free to write your responses in the chat box. So what would be considered big T trauma? I'll give you just a minute to gather your thoughts. So for those of you who have just joined us, we're talking about trauma and the difference between big T trauma and little t trauma. So in the chat box, please feel free to write your thoughts on what you consider to be big T trauma. Abiha and Saba, I'm seeing a message that chat is turned off for this meeting. Are we able to turn it on, please? Okay, so while they're doing that, I will just carry on just in the interest of time. So the way that we distinguish big T trauma and little t trauma is as follows. Big T would be considered massive life-changing events, such as war, natural disaster, the death of a loved one, physical or sexual abuse, terrorism, catastrophic accidents, and extraordinary or significant events that leave the person feeling powerless and having no control over the situation. So that would be considered big T trauma. And I see now that chat has been turned on for this meeting. Thank you for doing that. So please feel free to write your thoughts in the chat box on what you think would be some examples
of little t trauma? Now that we've talked about big T, what do you think would be considered little t? Small trauma could be like emotional abuse, bullying. Yes, Ayan, I think that's a great example. Thank you. Thank you, Tara. Appreciate it. The joys of, technology. What else would be examples of little t trauma? Racism and discrimination in the workplace, divorce, custody battle, inequality, definitely microaggressions, absolutely. You're all on point. So little t trauma would be things like divorce, infidelity, financial difficulty, legal issues, interpersonal conflict, career issues. Diagnosis with a disease might be considered big T trauma because that is life-changing, especially, if it's a terminal illness. So thank you, Sharika. I think, that's a good point. I think it would depend on what the diagnosis is and what the prognosis is as well. And Ferial says any incident that is not life-threatening. So yes, I think that's a really good way to put it. Thank you, everyone, for your thoughts. So we each experience both big T and little t trauma at work and at home. How can we manage this? How do we manage this in our daily lives? So one way is by incorporating trauma-informed practice into the work that we do with clients, as well as with our colleagues. Next slide, please. Great, thank you. So let's define trauma-informed practice. I think this has now become an expectation in the helping professions, especially in the work that we do in the front lines with newcomers. Essentially, there are 6 principles of trauma-informed practice. The first and foremost is safety. And this is not just physical safety, but it's also psychological safety. So you are providing a safe space for clients to come in and meet with you or online, but you're also providing a safe space emotionally. You want to be able to make room for emotions. You want to give them space for that. The second is trust. And I'm saying this in sequence, but they're not necessarily in any order of importance. Transparency and dependability is key. Really being authentic, saying what you mean. Collaboration, working as a team with your client and others on the case management team. If there is somebody who is doing employment, or I don't know what you have in Ontario, but we have Work BC out here in BC. And sometimes settlement workers or other frontline staff will work together with those people for their newcomer clients. Empowerment. This is really key. Making sure your clients have a voice and have a choice. Offer them options. Don't delegate, don't direct. Make sure they have agency. Peer support and trauma competence. So really recognizing the impact of the work that we do on ourselves and on our colleagues. And then looking at the cultural, historical, linguistic, and gender responsiveness. So within ourselves, moving past stereotypes, recognizing our own biases, having respect for different belief systems, different philosophies, different experiences. Next slide, please. Great, thank you. So how do we do this? By using trauma-informed language. So, of course, one of the most important aspects of trauma-informed practice is the language that we use. When you're talking to someone who has experienced trauma, as many of our newcomers have, ensure the language that you are using is respectful. And remember, respect can also be delivered via tone of voice. So rather than using a heightened or aggressive pitch, use a neutral tone. For example, if I say, this needs to be done as soon as possible, in a very kind of aggressive and assertive manner, versus this needs to be done as soon as possible, in a neutral way. Can you see the difference? Can you see the difference in the language and perhaps the trigger it might invoke in someone? Hopefully that resonates. So trauma-informed language should be non-judgmental, number one. Clear. So use plain language. There's no need to use academic language. Keep it simple. Instead of saying you need to be cognizant of, you can say something like you need to be aware of, right? Or yeah. Strengths-based. So make sure the language focuses on abilities, talents, and resilience, the resilience of the individual, rather than focusing on their challenges or their difficulties. And remember, don't focus on the person, focus on the behavior. So rather than saying their partner abused them, say they were in an abusive relationship. Rather than saying trauma victim, you can say a person who has experienced trauma. Does this resonate with people? Just quickly write in the chat box, if this sort of, great. I see some of the emoticons. Thank you. That really helps for me to know that it resonates with people. Thank you. Okay, next slide, please. Great, thanks. So it's also important to consider the following factors when you are using trauma-informed language with both clients and when we're talking to our colleagues. Use the first person. Avoid blaming, shaming, or naming. Avoid triggering language or words. Now, this might be difficult because we don't always know the words that might trigger people. And the best way to find this out is really in conversation, right? When you're getting to know your client, you'll find out maybe what their triggers are, especially if they have come from a war-torn country or if they have experienced that type of conflict. Loud noises might affect them. Speaking in heightened tone might affect them. So it's really in conversation with colleagues and with clients that you will come to know that and come to understand that. Respecting boundaries. So if people say that they don't want to talk about something, don't push it, right? Just respect them and meet them where they're at. Everybody's in a different place on their journey. And it's important for us as frontline staff in helping professions to really make sure that we meet the client where they're at. Along with that goes with providing support to our colleagues. We want to make sure we meet our colleagues where they're at. Many of the people that we work with, ourselves perhaps included, are racialized newcomers ourselves. We've been through that experience. We know what that feels like. So definitely we have that in common with colleagues and clients. And as I said before, providing options to clients, making sure they have the agency to make decisions. Next slide, please. So has everyone heard the term vicarious trauma? What do you think this means? What does vicarious trauma mean to you? Feel free to write your thoughts in the chat box. I'll give you a bit of time to gather your thoughts. What is vicarious trauma? Trauma from hearing or seeing something happening to another. Absolutely, Shannon. Thank you. How else? Any other thoughts? How else would you define vicarious trauma? When you feel someone's trauma. Absolutely. That empathy, that compassion, right? Experiencing effects of trauma by hearing things from clients, for example. Thank you, Casey. Yes. Thank you, Maureen. Appreciate that. Absolutely. And in the work that we do, when we see clients every day who have experienced and are continuing to experience trauma, this can impact our own mental health. So exactly, Summer, trauma from experience, even if not directed directly at a person. Yes. So this is all great examples of vicarious trauma. So let's talk a little bit about this. Have any of you ever experienced vicarious trauma? If you have, and if you feel comfortable sharing, what did this look like for you? How did it show up for you? Again, please feel free to write your answers in the chat box, and only if you feel comfortable doing so. So if you've experienced vicarious trauma, what did this look like for you? How did it show up? And how did it show up in your body? How did it show up in the experience? Right? Unable to stop thinking about the client's challenges, unable to focus. Thank you, Lizette. Thank you. That's a big one. Absolutely. Feeling sad, feeling anxious. Thank you. Depression and physical numbness. That is a really interesting one, Fariel. Physical numbness. Yes. Worrying about clients, difficulty sleeping, anxiety. Thank you, Oksana. Absolutely. And I can see a lot of you feel the same way. I can see the thumbs up. Feeling helplessness, right? What can I do? I feel helpless. What more can I do to help this client or to help my colleague who might be going through a traumatic experience, right? And yes, Marguerite, triggers other aspects of our own trauma. That is huge, right? It can trigger when we are experiencing that compassion, that empathy. It can give compassion fatigue, right? You all may have heard of that term, compassion fatigue. Okay, so losing residents experience grief. Okay, Maureen, yep, emotional fatigue. It has come up for me just by watching the news and hearing from my family members back home affected by war. Absolutely. You know, we are worried about them. We feel helpless. We don't know what we can do. We feel like, how are we going to express our voice? What can we do? What is our platform? You know, some of us want to scream. We want to yell. We want to, punch something. We're angry. We are depressed. We are anxious. We're sad. We're hopeless, right? We feeling these feelings of hopelessness. I have seen people being mistreated due to their addictions or where they live. And the unhumanistic attitudes directed at them made me feel hurt that people could treat people like that. Even though I was not affected, I felt heartbroken and worried. Thank you, Summer, for sharing that. Thank you. Feeling guilt of being lucky in comparison. There, but by the grace of God go I. Anyone heard that term? There, but by the grace of God, go I. Any one of us, one different decision, one different road that we take, one less support system that we have, and we could be there. So there, but by the grace of God, go I. And I think sometimes that guilt of the privilege that we have, and I think this is what makes us so good. This is what makes you so good at the work that you do, because you feel that compassion, you feel that empathy, you know your privilege, you want to give back, you want to help people. Absolutely. Thank you so much, everybody, for sharing your thoughts and your experiences. Okay. Next slide, please. Great. So a lot of what you said is listed here, and some things which, may not have been said are listed here as well. So some signs and symptoms of vicarious trauma. So how do we know when we are experiencing vicarious trauma? How do we know when we're feeling this? Sometimes, we're so busy doing our daily job, doing our work, that we don't know this is affecting us. So really, people said about, having invasive thoughts of the trauma of someone that you are caring for. So you're worried about them. You're worried about the challenges that they're facing. Feeling hypervigilant or numb. Somebody had mentioned the numbness. And sometimes, we can feel also that loss of empathy because of that compassion fatigue. Feeling frustrated. Feeling fearful and anxious, right? Disturbed sleep, perhaps even having nightmares. What's happening back home? Is my family safe? What's going on, right? Not knowing. Problems managing personal boundaries. And sometimes we do this by, we take on so much work, we want to drown ourselves in the work to avoid feeling those emotions, to avoid feeling those feelings. And then, of course, burnout comes on, right? So it tends to be a little bit of a vicious cycle. We feel a loss of pleasure in daily activities. For those of you who enjoy nature, perhaps you don't enjoy going out for walks as much anymore. For those of you who enjoy binge watching shows, perhaps nothing, gives you that satisfaction. Just not feeling anything, feeling empty. Social withdrawal, just not wanting to engage with people, avoiding friends, not wanting to go out in social situations. Sometimes we take on negative coping skills, right? Both personally and professionally. Like I said, we can become workaholics. We might turn to substances, or we have an increasingly pessimistic worldview. The world is devolving. Oh my God, everyone's going crazy. What's happening? There's something every day. There's something in the news. People are just stupid. There's no, there's no common sense. There's no empathy anymore. People are selfish, right? You just start to take on this kind of pessimistic worldview. Or it could go the opposite direction, where you're not, motivated to work anymore. Rather than kind of taking on more work, becoming a workaholic, you have that loss of work motivation. It's like, I'm tired of this. I've been doing this for too long. I can't do this anymore. Those feelings, right? For those of you who might be religious, who prescribe to a specific religion, you might distance yourself from those spiritual beliefs. You might start to doubt your faith. You might start to doubt, the higher power. Or for those of you who believe, in the universe, it's like, okay, universe, what's going on? Right? So there's that as well. And then this is what can bring on stress-related medical conditions, right? This is where migraines come in, headaches, high blood pressure, cholesterol issues, right? Things like that. So are there any others that you can think of, signs and symptoms of vicarious trauma, that have not been captured here, or that you've seen, or that you've experienced? anything else, please feel free again to write your thoughts in the chat box. So again, anything else that you feel that, or do you think that things have pretty much been captured? I'll give it another few seconds, otherwise we will carry on. Okay, I think it was a comprehensive list, and people also offered their thoughts earlier on. Let's see, I think we have some new messages. Okay, fear of going to work. Yeah, feeling empty, feel like, oh, I love this, feel like being in a fog. You know, you're just, yeah, everything is just foggy. You're not thinking clearly, you're not seeing clearly. Um, Fear of going to work is an interesting one. Is that, and you know, Marguerite, feel free to expand on that. Is that because you know, are feeling tired and feeling that kind of mental and emotional exhaustion, and you're not wanting to sort of deal with those types of situations anymore? Am I capturing that correctly, or is there anything more that you wanted to add? Overload from hearing the situations. Okay, absolutely. So again, that overwhelm, right? That emotional fatigue. Passion and new direction rather than a negative symptom. Okay, so that's actually a way to combat that, right? Summer, I'm assuming, is trying to find that revised or reviewed or revived, I guess is the word for it, passion and new direction, rather than focusing on the negative. And yeah, just exactly in a fog, as if you're floating. And those of you who have experienced grief and loss, you might know that feeling. You're just, you know, for the first little while, you know, they say the first 2 years after a loss of a significant loved one, so that is a parent, a child, a spouse, it's called early grief. And this is where you kind of walk around in a little bit of a fog. So some of you might, it might resonate with some of you. You might understand what that feels like, right? Thank you, everybody, for sharing. Okay, next slide, please. Okay, so now that we've talked about the different types of trauma, how do we manage this in our everyday lives, right? What can we do to remind ourselves that there is good in this world? There are good people, and that we can experience joy both personally and professionally. So Summer mentioned, you know, trying to revive that passion, trying to remember why we got into this profession. Why do we do this work? Because we want to help others. But remember, sometimes we need to step away, right? We need to step away to take care of ourselves. We need to step away to make sure that we don't get so overwhelmed that we burn out, right? Communicate, education, and boundaries. Absolutely, Summer. Absolutely. So really, you know, there's a few different things that we can do. One of the things is changing work patterns, right? We can maybe take some time to work less. So for example, in our sector, sometimes the summer months can be a little bit slower. Not always, but a little bit, it can be sometimes a little bit slower. So maybe we can adopt a more flexible work schedule during that time so that we can take some time back for ourselves. You know, maybe avoiding taking on extra projects or doing overtime. I know that's not always feasible, especially in our sector, but just trying to find that balance. Developing some coping skills, right? So time management, conflict resolution, obtaining social support. So both from colleagues and family. You know, there's no shame in reaching out and saying, I kind of need some support, or hey, you know, do you want to grab a coffee? I'd love to just chat and talk about nothing, you know, or talk about our favorite shows, or, you know, the latest movie that you watched, something that is unrelated to the work that you do. And of course, we all know this because we see it all the time. The sort of utilizing relaxation strategies. So really that wellness, right? deep breathing, meditation, yoga, promoting good health and fitness, eating healthy, having a workout routine. Even though, you know, when we're kind of down in the dumps, all we want to do is eat ice cream and chocolate all day, or that's what I want to do. I don't know what the rest of you do, but that's how I cope, is I eat chips and chocolate and, you know, ice cream, and just, I want to just drown my sorrows in sugar. Regular counseling, absolutely, for real. I think that is so important. I'm a huge believer in counseling, and I'm an advocate of that. So I absolutely would recommend that for anyone. Developing a better understanding of yourself. You know, we're so busy. Every day we're so busy. Many of you, you know, have spouses, have children, have multiple responsibilities. You may not have the time to really think about, you know, who am I? What do I want? You know, how do I manage in my life? What do I see as joy? How do I fill my well? Right? Those self-analyzing techniques, and really kind of taking the time to get to know ourselves, right? Sharika says, have a chocolate. Absolutely. Have more than one. Maureen says, setting boundaries. Absolutely. Setting boundaries is so important. And, you know, I have to say that, and let me know if I'm wrong, but I think that since COVID, people are a bit better about setting boundaries for themselves. I think, you know, if COVID taught us anything, it's the importance of family. It's the importance of our time, right? It's the importance of personal time. And so I think that we're getting better at setting those boundaries. Speaking out, absolutely. You know, when you're not comfortable with something, or you don't agree with something, or you're not willing to take on that, you know, that extra work, speak out and let people know that right now you're just, you don't have the bandwidth for it. You don't have the emotional space for it, right? Um, Counting little successes. Absolutely. You know what? Celebrate the little wins. Celebrate the little wins. That is so important. You know, and whether that means getting a coffee for yourself, or having you know, a chocolate bar, those, or even a piece of a chocolate, is really celebrate those little wins, because that will give you that pleasure. That will give you that pleasure back, right? Chatting with a friend or a family. And yes, you know, speaking out can be sort of a two-edged sword. And, you know, we can definitely, we can all relate to that, right? So, but I think that if that's done in a respectful manner, you know, that would have to be kind of each individual person's decision as to whether that's something they're able to do or not. So I don't want to push that on anybody, but I do want to encourage you to find your voice. I think that's really important, right? Thank you so much, everyone. Next slide, please. Okay, so this is the self-care wheel. Has anyone seen this graphic before, or a variation of this? You might have, right? The self-care wheel focuses on the different aspects of our lives. So I see some thumbs up that people have seen this wheel before. Looks similar to the medicine wheel. Yes, I think it might be, you know, a variation of that. Absolutely. So it looks at the physical, psychological, emotional, spiritual, personal, and professional aspects of our lives, right? So this will give you some additional insight into coping strategies and mechanisms to utilize when you are, you know, kind of feeling that overwhelm, right? You're feeling overwhelmed, you're not sure what to do. So for a psychological, it talks about therapy, talks about journal writing. You know, journal writing is a really good way to kind of get your feelings out, right? It can be quite cathartic. Having self-awareness, engaging in art therapy, drawing, painting, for those of you who are artists, right? When you look at the emotional, having self-love, having self-compassion, right? Laughing. I think that's so important. We have to laugh. Spiritual is finding a spiritual community, right? Playing, taking time out of our lives to play. When's the last time you actually played? Go out with your child and, you know, make a snowman or jump in the leaves and do things like that. Try and be inspired. What inspires you? Who inspires you? Think about those things, right? Learn about who you are when we're talking about the personal. Figure out what you want in life. Make a vision board. Things like that, right? And professional is, again, you know, take time out for lunch. How many of us take lunch on a regular basis, right? So definitely read through this in your own time. I think you will be sent the PowerPoint presentation. So definitely take a look at this in your own time and try and find what resonates with you. Maureen says, I feel this wheel helps to balance life. It grounds a person again. And yes, and that's what we want. We want to be able to feel grounded. That's a great word. Thank you. Next slide, please. Okay, so this is just another resource for you to review in your own time. It again incorporates different activities for the body, for the mind, and for the soul. And, you know, feel free to use this as a way to plan for what you might do when you are experiencing trauma. Because when we're in that overwhelm mode, when we're in that fog, or, you know, what I call when we're in a depressive state, when that cloud, I call it the cloud, when that cloud is following you around, you can't think clearly. So try and write some things down now when you can think clearly, so that when you are in that fog, you can go back to this and practice some of these things. So it's good to take some of those preventative measures, right? And be a little bit proactive. So use this as well if it's something that might work for you. Next slide, please. Thank you. So the last topic I would like to talk about before we open it up for discussion and Q&A is trauma bonding. Has anyone heard of this before? Trauma bonding. What does trauma bonding mean? Okay, I see some thumbs up. Please write your thoughts in the chat box. What do you think trauma bonding means? People build a connection due to going through trauma. Yes, that's a good one. Absolutely, Summer. It can cause a false reality of love, right? And we see this in intimate partner violence, right? Where the survivor often forms a bond with their abuser. You may have heard of Stockholm syndrome, right? Stockholm syndrome. So this is kind of similar to that. Codependency. Yeah, codependency, definitely. What else? Anything else? Okay, so how does trauma bonding show up in the workplace? Okay, so Summer says also people who trauma bound, say two girls who went through something traumatic, they will only confide in each other. Yep, that's a really good way of expressing it as well. So can you tell me how trauma bonding would show up in the workplace? Any ideas, any thoughts? And it's a relatively new concept, sort of that trauma bonding in the workplace. But what it could be is, you know, when you've shared a traumatic experience with your colleagues, and this can include a wide range of things. So it can include a toxic work environment, a conflict with a colleague, collective vicarious trauma. You know, when, for example, those of you in frontline work, those of you who are settlement workers, you might have experienced this in helping clients in groups. So for example, people who came from Ukraine, or when we had Operation Syria way back, in the day, or Afghanistan. So this is kind of that collective vicarious trauma when you and your colleagues are going through sort of those similar experiences, right? So what do you think that we can do about this? What can we do um, to help our colleagues and ourselves in trauma bonding? Any ideas? Okay, I think maybe people are getting tired of writing in the chat. So really, it's the same thing that we would do for our clients, right? We want to have that trauma-informed lens, right? We want to practice from a space of empathy and compassion, but we also want to make sure that we have compassion for ourselves, right? So Summer says a safe, open space. Sometimes in the workplace, people don't feel like they can speak freely. And I think, you know, I think it's up to us as colleagues to be able to provide that. Sure, Marguerite, you said provide again the definition of trauma bonding. Yes. So trauma bonding is when a person forms a deep emotional attachment to their abuser. That's sort of the traditional definition of trauma bonding. But trauma bonding in the workplace is when you have a shared traumatic experience with your colleagues, right? So this can be, if there's a toxic work environment. Somebody had mentioned bullying earlier, right? So this, or collective vicarious trauma. So those would be some of the definitions. Marguerite, I hope that answers your question. Okay, so yes, Sarah mentions regular, I'm going to put my glasses on, sorry. Sarah mentions regular debriefs as part of the structure of the workplace. Yes. Mahmoud says he heard about schoolgirls fainting together in big numbers. Is that trauma bonding? I'm not sure. I'm not a medical professional, so I'm not sure if that was related to a specific incident. So I can't say for sure whether that would be considered trauma bonding. But thank you for bringing that up. Sarah says responsiveness to concerns by supervisors. Summer says workplace appropriation as well. If the workspace does not feel stigma-free or free, one may be less inclined to share. This could cause a disconnect. By appropriation, I mean the language within the office or workspace. Yeah, absolutely. Each workspace is very different. Each workplace has its own, culture, has its own language. And it's really important for us to find our own identities within that. I don't know if many of you work in unionized environments. There in BC, we have a lot of unionized environments. Even in the nonprofit sector, I worked in a unionized environment in HR and labor relations for a very long time in nonprofit, and it can be very different. It can be a little bit more challenging. So it really kind of depends on the work environment, right? Self-awareness of trauma bonding and being able to recognize it through open conversations with coworkers. Marguerite, you've got that. Absolutely. So again, creating that safe space, being able to speak openly and freely. And I think it also, lands on the leaders as well, right? To be able to provide that space. And I know that's one of the ways that I wanted to make sure when I was in a leadership position in an organization, I adopted the concept of servant leadership, where it's my responsibility to ensure that my team members had the tools that they needed to be able to do their jobs. It was my responsibility to provide a safe space. So I think a lot of that, depends on leaders as well. But also ownership goes to you as frontline staff to be able to voice that, to be able to speak up if you're not getting what you need. And remember to do that in a respectful manner. Remember to do that following policies and procedures and lines of communication, just making sure that that you are following the guidelines of the workplace itself. I hope that makes sense. Okay, great. Thank you everybody for writing in the chat. Okay, next slide, please. Great. So here are some ways that trauma bonding can show up in the workplace. And many of you said a few of this, right? So, a little bit of that mistrust, feeling like you've been through so much, in this particular job, you're not ready to kind of throw it all away. Criticism is another thing, manipulation and gaslighting, not being briefed. Somebody mentioned about regular briefing. So when you're not being briefed on important issues, but you're still expected to know what's going on, right? This thing I think might resonate with you is constantly saying you're going to quit, but you're not leaving because of fear that things could be worse with a new employer, right? And it's really kind of choosing, the evil versus the evil you don't know. And I'm using evil in a very kind of comedic sense. Loss of self, right? A lot of us identify with our work, right? What is the first thing that people ask you when you go to a social gathering? Oh, hi. Oh, what do you do? Hi, Farah. What do you do? Right? So when we don't have a job, who are we? Who am I? If I'm not the co-manager of Vancouver Local Immigration Partnership, or if I'm not a clinical counselor, or if I'm not a career counselor, who am I? And I have to say that, I was laid off in 2014 in a job I had been in for almost 10 years. And it took me 2 years to find work. I had an identity crisis. Who was I in those 2 years? So this is huge. And this is a very prominent reason that people sometimes stay in jobs they're not 100% happy with. Now, we're not going to be 100% happy all the time in the job that we have, in the work that we do, right? There's going to be ups and downs and ebbs and flows, right? We're going to feel insecure. Yes, Sharika. But a lot of times it's because we identify ourselves with our work. We tie in our identity with the work that we do, right? I hope that makes sense and that resonates with people. So Summer says, could trauma bonding in the workplace be a new employee being controlled by the first colleague that made them feel important in the workspace? Now, this depends on the new employee. So is it your perception that they are feeling controlled, or have they said that they are feeling controlled, right? So often we see things through our own lens, right? So I'll see someone and I'll be like, oh gosh, that person's being manipulated, or that person's being controlled. When really for that person, they don't see it that way. They see it as this person is helping them, is being a colleague, is being a buddy. So again, right, you don't want to put your own thoughts and feelings onto that other person. You don't want to project that, right? So moving on with other signs of trauma bonding. So again, that cycle, right? This is the perfect job. You throw yourself into your work. Then you feel resentful because you have so much to do. Then you feel burnt out. Then you take a step back. Then you're able to revive that passion. You go back in, and it's kind of a vicious cycle. And really, again, boundaries, not having those boundaries. Does this resonate with you? I'm sorry, I know I'm using the word resonate a lot. Feel free to write down, your own experiences in the chat box. Again, if you feel comfortable sharing. Is there anything else? Anything else that may not have been captured here? Okay, we'll move on then. Next slide, please. Okay, so we're almost at the end. I have put together a list of resources. There is so much information on the internet. So I believe, when you do get this presentation, feel free to review some of these resources on your own time. There's a lot on trauma, trauma-informed practice, vicarious trauma, trauma bonding, lots of great sort of worksheets and tips and tools for you to try. It's going to be different for each of you, right? Something that might work for one person may not work for another, and it'll be trial and error. So feel free to kind of experiment and see what might sit for you. Next slide, please. Okay, so that brings us to the end of the presentation. Thank you so much for your time and for joining today. And, I want to end with just thanking you all for the work that you do. It's grueling work. It's very difficult. But I want you to know the impact that you have on people. And thank you for doing what you do, making sure that, Canada becomes a more inclusive space for newcomers. And I hope that you continue to live your passion and work your passion. So before we open it up for Q&A, just wanting to remember, this is a safe space, right? So please show that mutual respect that you have been showing all along. There's no judgment. There's no shaming, naming, blaming. Feel free to share your experiences, ask any questions, and really engage in discussion. I think we have about half an hour, so we've got some good time for some good discussion. So thank you so much. Thank you, everyone.
Thanks, Farah. I'm not sure if we're able to flip it so that everybody's able to come on screen and ask their questions. Maybe people can use the chat or the Q&A if you have questions for Farah, and she can take them from there.
Sure.
Tara, I did enable the video and audio for all the attendees.
Okay, perfect. So maybe raise hands if you have questions or comments that you'd like to make. And we can take them in turn. Or experiences that you'd like to share while we're here together and have Farah with us to talk through. I see Nerman.
I
Hi,
just
Norman.
looking at the I just gonna have the question actually maybe not really related with the trauma things. The issue is actually the refugee claimants, especially accessing, the healthcare system. What I experience is like, the sanctuary refugee center doesn't really accept any more new patients, but there's so much like, the refugee claimants who has like, the chronic illness. They need like, the immediate like, the service. But the issue is finding with the family doctor and not able to access like, to the service with the sanctuary center. I'm just like wondering if anyone knows that any kind of like, the service that we can guide these people.
So that's nothing, unfortunately, that I can help with, but Tara, maybe, I don't know if there's anyone else that might be able to speak to that.
And I'm not sure that we have anybody from any of the speakers from our session this morning still with us. Some of this they did speak to, and well, first acknowledging the real challenge that we have around capacity of our local health system, and our refugee health clinics in particular, with their long wait lists and their inability to take on new clients right now. They did mention, I believe, that they are like triaging to try to get the highest priority people in to be seen right away. So to me, that sounds like should still be connecting to them to try to get people on their radar. But in the meanwhile, you know, in the absence of a more robust primary care setting in our community and many others, you know, people are reverting to our hospitals, emergency departments, and other places. We are going to be following up with questions and answers after this, and we will include this one for clarification by some of our health leaders who were here this morning when we come back to everybody with resources from the whole day today.
Okay, thank you so much.
Do you want to just handle the chat, Farah, or do you
Sure.
want me to manage it for you?
No, I can
We didn't
do
talk
that.
about
Thank
that
you.
before. Okay, you go ahead.
Thanks so much. I think that somebody has their hand up. I think it was Marguerite.
Yes, hi,
Marguerite,
Farah.
Hi.
Hi, I'm over here in Ontario, which Cambridge, Ontario. So what we've been seeing is a lot of individuals, refugees from, well, initially the Ukraine, and now more from Nigeria and the South African or African countries. And something for like vicarious trauma is like working with individuals. I'm in the employment part of social services, is listening to the story, obviously, as you develop that trust relationship so that they can actually tell you the story or parts of it. A lot don't. But what I've been feeling, I don't know if anybody else on the line does, is the overwhelming empathy that one feels. And for me, because my parents were older and they immigrated from Europe during the war, World War II, it was it's like a trigger, not a trigger, but you want to do the best, like over and above the kind of over and above than you maybe for the rest of the clients that you might see. It's just because that triggers me because I know how my parents were treated as well when they first immigrated to Canada. And so you want to go above and beyond because of the war situation. And it's how I process it afterwards and just kind of take a deep breath and kind of think, my mom and dad would have been proud of me, like, and not telling those stories to my coworkers because they too have their own stories that they're seeing with it. And I appreciate the conversations that you've had. I've been in social services for 40 years. And
Wow.
sometimes that's why I said sometimes it's a feeling of not coming to work, right? Fear of coming to work because the stories are so sometimes blended. But I just wanted to share with you like a simple, like to me, it may be a simple thing, but I also realize that sometimes we are all that these refugees have witnessed the positives. And so we might be that first point of contact that says, we can help you. So it's that overwhelming empathy. And I know some of my colleagues will just go into their offices and just cry because they don't have that. What's that word? You don't have a
Like
point
an
of
outlet,
contact. Pardon?
support system, like a support system or an outlet.
Well, they don't understand either. I mean, if they're in their 20s, 30s, or whatever, they don't
Okay.
have that point of contact. And then you may have
Right.
other co-workers who may be refugee claimants themselves or on permanent residency. They have come from that. So there's a whole mishmash, and being aware that it's not only with the client is that support from your coworkers and
Yes.
understanding their story. So it's a whole bunch of stories going on, right? So, and just
Yeah.
that's why I said being self-aware where you're at in your journey and
Yes.
making sure that you're grounded for that trauma that you're facing or that trigger. So I
Yes.
really appreciate the conversation. It was like a really good refresher actually for me, but also it brought back a lot of good things as well. So I appreciate it.
Thank you. Thank you, Marguerite. And, I have to say that some of that also comes from lived experience, right? you know, those of us who have been in the sector for many years, or, you know, are like, I've been in the workforce now for 30 years, right? So I think we might have honed in our coping strategies. And so I sort of take it, you know, as my obligation when I have younger colleagues who are new, and not, you know, struggling a little bit. I want to be able to reach out to them, share some of my coping mechanisms with them, and say, you know, this is not easy work. And there will be times when you feel overwhelmed, when it triggers you. You know, these are the things that I've done that have worked for me, and you just kind of need to find your own space for that. So, you know, don't be afraid to do that. And if they don't want your advice, they'll tell you. But I just think that, you know, there's something to be said for those of us who have been in the sector for so long. I think we have a lot of lived experience to be shared. So thank you for that. And thank you for, you know, the work that you do and not giving up. I mean, being in the sector for 40 years, there's so many times when I'm like, I am so done. I'm done with our funder, and I'm done with, so yeah, thank you. Thank you very
welcome.
much. Appreciate that. Ferial, I think you have a question.
I I don't know whether it's a, sorry. I don't know whether it's a question or it's a I wonder a lot on this that, you know, are we just adding to the medical or, you know, mental health requirements because of the number of cases that I see and I work with every day, day in and day out, that it really affects 15 plus years in this sector as a frontline worker. I think there's a lot of pressure on us, and the support system is so low, and the pressure keeps on growing. I don't even realize at what point did am I facing trauma, a vicarious trauma, or is it just now that my body is functioning differently? So I just would say that, you know, I know that our local immigration and partnership is also there. How do you support the frontline workers in that way? Because there's a lot of pressure, especially when you get clients, a lot of clients who are not eligible for services, and that pressure is on you to provide them with services, and you don't have those. You cannot help them, and you are very, you don't know what to do in that way, and you take it on yourself. I can understand, and I was the one who said counseling, regular counseling is important. But even when you're doing regular counseling, sometimes it's ineffective because you are human, end of the
Yeah.
day. So the pressure is really on the front line,
Yes,
yeah,
I agree.
who are seeing the clients, and those people at the back are not witnessing and not going through the same same trauma as them. So I would say that, you know, how do we strengthen the front line? How do we build that capacity in that sector, or be more appreciative and recognize in many ways, not just say hello, good job, not that way, but say adding to something more to their, before even, you know, adding more pressure and adding more to their portfolio. So I am really concerned about this because I have been in this region for many, many years, and in this sector as a frontline worker for 15 plus years. So I can see how it's affecting my colleagues and my people in my profession. Thank you.
Yeah. No, absolutely. And I definitely agree with everything you said. My number one wish and my number one ask every single time I have an opportunity with IRCC or CFP or whatever it might be, mental health training, mental health training, mental health training. So, I mean, and not just training, but mental health support for our frontline staff, for our clients. You know, it's always been beyond me that IRCC will fund everything for a newcomer to be moving into a new country except mental health services. That for some reason that just, it doesn't sit with me. I don't understand how that can be such a big gap. Now I've been, hitting that stone for the last like 15, 18, 20 years. So I don't know if that will ever happen, but I think that as organizations, there's something perhaps that we can do in bringing that mental health awareness, training, counseling services to our frontline staff. So something that we've done in BC, especially, the Vancouver Local Immigration Partnership is hosted by 2 neighborhood houses. I don't know if you have neighborhood houses in Ontario, but neighborhood houses are grassroots, they are ground up. It's not like agencies where there's 300-400 people. It's really kind of in the community. So it's hosted by South Vancouver Neighborhood House and Mount Pleasant Neighborhood House. And we have a neighborhood house consortium that holds mental health workshops every year, so that our frontline settlement workers can get that support. And that is specific funding that we asked for from IRCC. So I do think that there are ways that organizations can do this. And again, I don't know Ontario, so I don't know what the funding is like there, the local funding, but I just think that that's a good way of trying to fill in that gap that the funders aren't giving us directly, right? And maybe finding some other ways. So if that funder isn't available, trying to find other pots of money that might be able to fill that gap. The other thing that we're doing is, some of the neighborhood houses are actually, so I'm doing some work with a neighborhood house in group sessions, right? So we have a group of frontline workers who want to be able to have a safe space to talk about some of the things that they are experiencing with their clients and, the conflicts that are happening around the world. So we do group sessions together, and then there's an opportunity for individual one-on-one. So that might be something that we can do. But I agree with you, Ferial, and I wish I had that magic wand that, could just have that funding for everybody. Unfortunately, that's not there. So we're going to have to try and figure out what we can do to bring that. We're going to have to try and get more innovative. And I honestly don't know what that looks like. But I appreciate you bringing it up, and you're not alone in bringing that up. So I hope that gives you some ideas just about what we do out here in the West. And I'm not saying that's on a big scale. This is like very small scale stuff. I'm really hoping that it picks up because I think it's really needed. Thank you. Thank you for that. Yes, so Ferial, you're saying not just mental health support, but also increasing number of frontline workers and better compensation packages. Yeah, compensation is huge, right? And also having that, the benefit packages. So, mental health support is not always included, or if it is, it's, the practitioner portion is quite small. So there's that piece too, but, there's only so much that leaders can do. It depends on funding. And then, I don't know if there's sort of like here, we have an association of neighborhood houses. So all the neighborhood houses have to go according to that grid. They can't pay more, they can't pay less. The compensation is universal. The benefit package is universal. So there are those types of barriers as well. So I'm not sure what's out in Ontario, but I'm sure it's quite similar to that. So yeah, lots of challenges that I'm sure everybody is working to overcome. So thank you for that. Any other questions? I think we still have about 10 or 15 minutes. Questions, comments? Oksana, you have a question? Feel free to come online if you feel comfortable.
Hi.
Hi, Oksana.
I was just wondering, I'm from Ukraine and most of my clients are from Ukraine as well. And they've been asking me as well, as I was wondering if there are any places, maybe groups or classes for people who are traumatized by war and couldn't like get together, talk about it, go through the trauma. Maybe there are some sources that I can share with them, like
Okay.
local.
Yes. I'm so sorry. Unfortunately, I wouldn't have that information. I'm not based in Ontario, but I think the presenters that were on in the morning had some resources. Tara, is that right? I caught the last end of it, so.
Yeah, I would refer back to some of the discussion that our colleagues from Camino shared with us this morning, and Oksana will be sharing around the resources from the sessions this morning, and including, lists of the program schedules and stuff that are available at some of our local counseling organizations. And Camino itself has a lot of programs specifically tailored to refugees and others who have come from experiences of trauma and are, working with families and individuals directly to address the experiences that they've had.
Yeah, it was very hard for me to find just some psychiatrist or psychologist services that are available for them right now, because mostly everywhere is a huge waiting list. And yeah, maybe something online that I can share, even maybe some webpage for them to read and to find some useful information.
We can follow up on this specifically
Sure.
In the follow-up. Thank you.
Yes, thank you.
Thank you, Oksana. Thank you, Tara. Any other questions, comments, any experiences people would like to share? There's a comment in the chat. Hussein says he cannot access the recording. I don't know if anybody wants to comment on that.
We'll be sending that out in follow-up to all of the attendees today.
Thank you. Tariq says we have an understanding trauma workshop at the Woolwich Community Health Center coming up next week. He's given his email address. If you're interested, so Oksana, you might want to take a look at that in chat. And Valeria says there are some Ukrainian support group online, which are run by psychologists. So
Thank you.
yeah, thank you, everyone. You are so helpful.
A little bit of crowdsourcing the resources.
Yeah. Summer says there's also CBT group sessions you can access online or in person that are trauma-based. So yeah, lots of resources. I know there's lots of resources out in BC as well, and we have TELUS. They have their online support systems as well. So any other questions specific to trauma-informed practice, trauma bonding, anything like that people would like to know about?
We've quieted down.
Yes, I think people are tired now.
Tired, yes.
I'll pass it over to you, Tara.
Awesome. Okay, well, as we close out our time together, I would like to extend a huge thank you to you, Farah, and all of our speakers again from this morning, to all of our participants. We are here, and to the comments that Faryal was making, we're here because of the importance of the front line in supporting newcomers and in building community for everyone in Waterloo Region, and recognizing, the importance of helping equip people working on the front line with the information and resources they need to do their job well, to support themselves and their clients as they help people through challenging experiences. And, hearing about the challenges that you have in your day-to-day, as an immigration partnership and with the leaders of our settlement and other organizations in the region, like, we're trying to do our part in helping the federal government, the provincial government, others understand the impact of their investment decisions, of the policies that they make, and to try to, push for change so that working conditions are better and the community is more ready to receive the newcomers who are coming in with all of the programs and services and supports and infrastructure that they need to be happy and successful. I would like to thank the staff and partners from our Settle and Belong steering groups for your planning of the session today and to everybody for participating. This is the first in a series of sessions that we will host over the course of this year that all address different topics that we hope are relevant to all of you, that we have kind of determined in consultation with our partners, your leaders. For me, the information and the insights and the strategies that have been shared with us in our morning session today and this afternoon by Farah are so valuable. And I hope will have a really positive impact on the work that you all are doing to support newcomers in our community. And as we are all trying to work together to build a better community for everyone. We will be sharing the recording from both the morning and afternoon sessions today, all of the presentations from all of our speakers. We will be curating responses to all of the questions and answers that were submitted before today and in the chat, various chat features today. And we'll also share a feedback form, and we would like to hear from everybody your experience with the session today. How did it go well for you? You know, as we are working to develop the next sessions in the series, we will be taking your input and making adjustments so that the sessions are as useful for everybody as they possibly can be. You know, and thank you again. Stay connected. We hope that you will continue learning, that you will come to the follow-up sessions and apply all of the knowledge and insights that have been shared today in the very important work that you do supporting newcomers who are moving into Waterloo Region. Thank you, everyone, and have a great rest of your day.
Thank you for inviting me. It was great. Thanks, everybody.
Thanks, Farah.